So the first procedure I'm going to demonstrate is the sacroiliac joint cryodenervation. I will show you how to do S1, S2, and S3 lateral branches with a special probe which is designed to do all the cryo at all three levels. It's very similar to radio frequency probe called Simplicity. The indication for that is that you do intra-articular and periradicular testing. There are discussions if you do only intra-articular or only periradicular testing. According to my experience, and there are some guidelines already within Sacroiliac Joint Society, 85% of cases are caused by periarticular causes. So it's really very important if you do your testing, first do periarticular testing. If it's positive, you can indicate your patient for a treatment procedure like a denervation. And if you have an intra-articular positivity, more than 70% pain relief after the intra-articular diagnostic block, you can go for intra-articular treatment of that kind of patient. We have an internal algorithm for intra-articular problem. If it's arthrosis, we go for a combination of hyaluronic acid and PRP as a first line of treatment. If this is helping the patient with some kind of physio, we are happy. If this is not enough, the second degree is to do cryodenervation. We stopped doing radiofrequency denervation because we have a feeling that cryo is giving us better results. And if cryo is not successful, the third degree in the algorithm is to do endoscopic sacroiliac joint denervation. In some specific indications, we also contact a spine surgeon to do the implantation, to do the implant, but it's very, very rare indications for the surgical procedure. Okay. First, what you need to do, you need to recognize where you have your sacroiliac joint and where you have your sacral foramina. I have already done one thing just to show you, I have already done one thing just to demonstrate how you are trying to identify S1, S2, and S3. What I normally do, I put needles, help needles, into all the foramens. So what I have here is S1, yeah? So this is S1, and you see the needle inside. If I do the lateral projection later on, you will see how it is going through the foramen. You need to know how to recognize which one is the posterior foramen and which one is the anterior foramen. To achieve that, you are moving your C-arm either from lateral to medial or from caudal to cranial, and your posterior foramen is going the opposite direction. So the structure being closer is going opposite direction, and this is actually your target. And then the same way you can identify S2, let's say it's here, and S3, let's say it's here now. I'm just, showing like that, and I don't want to do 3 more needles now. Then you need to know also where your sacroiliac joint is. So you have it here, and also you need to know which one is posterior and which one is anterior part of the sacroiliac joint. The same mechanism, you go either from medial to lateral, or here you go medial to lateral, and this one, which is going opposite direction, is your posterior part of the joint. And then for this cryo probe, we are going to use, you don't need to be focused on sacroiliac joint because your target are S1, S2, and S3 foramina. So actually, you will start down here between the S3 and S4 foramen, and then when you hit the bone approximately under S3 foramen, you will, I will show you in a lateral projection, continue up here, and the placement of your sacroiliac joint probe will cover the whole lateral part of the foramina S1, S2, and S3. And then you will create a huge ice ball at the whole area. And if you are lucky, you have to be very close to the bone because otherwise you will not hit those lateral branches, and very close to the foramina. If you fulfill all these conditions, you have a chance to cryodenerate lateral branches, so S1, S2, and S3. So, first of all, if you are using cryo, that's what I said yesterday, it looks like that, and you don't have any chance to inject anything through the cryo probe. So first of all, what you have to do, you have to inject a lot of local anesthetics, and then what you do is a small incision, I've done it here, and then you go with a normal needle and you inject a lot of local anesthetic and a lot of saline, because saline will create a nice ice ball. So it's good to deliver some kind of water to get ice. And then when you start with this special probe, you see this distance, and a little bit above and a little bit under will have an ice ball. It's a special curvature on the probe. So you are actually going to follow the anatomical shape of the sacroiliac joint, if you are lucky. It's not always very easy, yeah? When you are starting with this, you need some incision. You can check where you are. Yeah, maybe I can be slightly closer. And then you go face down with the curving. Approximately 45 degrees angle, just to hit the bone. When you hit the bone, it's good. And from this moment, you go to the lateral projection. Because what you would like to do, you need to be very close to the bone all the time. It's similar mechanism what Ihaya was explaining on the vertebral body. It's exactly the same here on the sacral bone. And additionally, it's the same mechanism. If you see something in AP, doesn't confirm anything until you don't see it in a lateral projection. And then when you're in a lateral projection, you can lose your direction to be very close to the foramina, so you have to check from AP lateral to AP again. Otherwise, your procedure won't be precise. So I need some assistance for lateral.
Lateral, please.
There are questions about where exactly to start. Normally simplicity, I don't know, those who perform simplicity procedure, you start at S4 level or under S4. Here I found it best if I start between S3 and S4 in the middle distance between those two foramina, but it's nothing scientific, it's my anecdotal experience. So, okay, so now we see that I am very close to the bone, it's good, and also we see that my S1 foramina is marked with a help needle. Now you're changing the direction of the probe face up, and you keep the direction, and you go like, and you go this face up and face down again, just to hit the bone again, to keep, yeah, and then you go again, up and down. I have very close contact with the bone, but at this moment, I'm not sure where I am in AP, so I have to go to AP again to be sure that I'm not going too lateral, yeah? So it's a little bit of work.
So you have to do an AP and lateral. Lateral will tell you
what I
how
recommend
close you are
when
to
you
the
are
sacrum.
at S2 level approximately like I'm now, you check your AP again, just not to lose the direction, yeah?
Sure.
So I'm here. If you have a slow radiographer, it will take ages. This one is not slow, of course.
He's good, he's good.
This is not AP.
AP, AP,
please.
AP.
AP. Come on, come on, come on.
AP.
Yeah, just go. Release. And it's caudal tip and towards you. Yeah. So you see that my direction, I haven't lost anything. I'm very close to foramina, and now I can do again a little bit more. I change and change again, and I'm going very close to the foramen. It's a little bit too medial, so Yeah, you can work with the curvature, and now
Yep.
I am on the lateral edge of the S1
S1.
foramen. Some of you would say it's maybe too close, but it's not. You have to be exactly there. Otherwise, you are too far,
From the
and
lateral
you
branches.
will not
Get it
create
up.
any lateral branches. Yeah. So people who are placing probe in the middle distance between the sacroiliac joint and foramina,
Losing a lot of lateral branches.
a lot of ligaments, no lateral branches, or everything is covered, and I don't think you can do anything. If I do endoscopic denervation, I do it exactly the same way. I see the lateral edge of the foramen, I take away the ligaments and tissue, and then I burn with a special probe. So I go slightly above it, a little bit more. Yeah, this will be my position.
So that's a starting
And
point?
This is the ending point, the starting point
Yes.
is...
No, but the starting for the cryo. So you'll start
Yeah,
cryo lesioning
Yeah.
there,
Yeah.
then you will move the probe down.
No, I will not move anything.
Okay.
Because now you will have the ice ball between S1 and S3 foramina.
Okay.
The whole way down with one
no need
probe.
to move.
No need to move. The only thing you need to do is your lateral
Lateral,
check,
please.
the final lateral check. And I will show you, you see
Brilliant.
now that I am
Fantastic.
from
Very
the
good.
bone. What I can do, I can change the direction like this,
Yes.
or I can change this like this.
Yes.
And in a normal situation, with this placement, I would not be 100% satisfied because the tip is a little bit too far from the bone. So I will try to improve it to get it closer. Sometimes it's not possible, so then you will do, actually, I will go like here.
Yep.
I will do lesion at this level.
Okay.
Yeah?
Great.
So this is how you can use the cryoprobe. Some people say they do with this cryoprobe also L5S1 dorsal ramus. I will show you quickly one thing. This is what happens if I go to the level of L5S1 facet. You're far away. So it's technically impossible. And those who say they can do it have never tried the lateral image for that. So you have to do it separately.
Sure.
That's it. Yeah?
Thank you. That's great. Thank you so much, Rob.